Hello students, myself Dipanjali Singh, School of Nursing, Sanskriti University, Mathura. So today we are discuss about the physiology of menstrual cycle. So welcome to you all. So firstly we will see the introduction of the physiology of menstrual cycle. So this is the introduction. So typically a woman of childbearing age, that is the 15 to 45 years, should be menstruate every 28 days unless she is pregnant or moving to menopause. The term menopause, we will discuss about it then, but the numerous things can wrong with a normal menstrual cycle, that menstrual cycle essential for the production of egg, for the preparation of the uterus for pregnancy. So there are a term that is the menopause. Menopause means the permanent cessation of the menstrual cycle. So this is the this is the introduction. Next we will see the definition of the menstrual cycle. So this is the definition. Menstrual cycle means cyclic uterine bleeding caused by shedding of the progestational endometrium. Progestational endometrium. It occurs between menarche and menopause. The term menarche means it is the beginning of the menstrual cycle, and the menopause means permanent cessation of the menstrual cycle. There are a term that is the progestational endometrium. In uterus, there are three layer is present. The outermost layer is the perimetrium, middlemost layer is the myometrium, and the innermost layer is the endometrium. That is also called the progestational myometrium. Sorry, progestational endometrium. So this is the definition. Next, there are the one definition is also the menstruation is also called menstrual bleeding, menses, or a period. Then next we will see there is the characteristics of the normal menstruations. The first one is the menarche. Menarche means beginning of the menstrual cycle, that is the age between 4 to 16 years. Then average is the 13 years of age. Then duration of the menstrual cycle is 2 to 7 days. If the less than 2 days, it is called hypomenorrhea. And if the menstrual cycle goes more than 7 days, then it is known as the menorrhagia. Then amount of bleeding according to, we will see the according to amount of bleeding, that is 30 to 80 ml, uses 3 napkins per day, and more than 80 ml is called menorrhagia, or less than 30 ml is called hypomenorrhea. So this is the characteristics of the normal menstruations. Next we will see fourth point. Then normally menstrual bleeding does not coagulate. Why this is don't coagulate? Because of there is a presence of fibrinolysin enzyme plasmin, which is prevent the coagulation of the blood, which is secreted by the endometrium, that is the inner layer of the uterus. Then menstrual malumina, this is also called as the premenstrual syndrome, refers to a mild symptoms before the 7-8 day before the menstrual cycle, your menstrual bleeding, and this is relieved before the menstrual relieved once the menstruation occurs. So what are the premenstrual syndrome? It includes like headache, heaviness, feeling of malaise, and mood swings. This all are included in the premenstrual syndrome. Then the next slide shows the hypothalamic pituitary ovarian axis. Hypothalamic means hypothalamic gland, hypothalamus, that is present in the brain, and the pituitary gland, that is the master of the gland, which is also present in the brain. Then ovarian axis, the ovaries, in which is present both side of the uterus. So what are the relationship between them? We will see there are two main components of the menstrual cycle, that is the changes that happen in the ovaries during the menstrual cycle. The changes happen in the ovaries, that is called the ovarian cycle, and the changes will happen inside the uterine cavity, that is called uterine cycle, and both are work together and simultaneously. No. Then next we will see, the changes in cervical mucus also takes place during the course of menstrual cycle. So here a picture shows, you can see this is the hypothalamus which is present inside the brain, then pituitary gland. Hypothalamus secreted gonadotrophin releasing hormone GnRH, that is GnRH, which stimulate the pituitary gland to stimulate FSH and LH hormone. FSH is follicular stimulating hormone, and LH is luteinizing hormone. Okay, then this hormone is responsible for the menstrual cycle. This hormone is responsible for the follicle stimulating and luteinizing hormone responsible for the ovulation process. Then there are some structure of the uterus. You can see there is the uterus, this is uterus, then left and right present of ovary, there are ovary present, then endometrium layer, that is the innermost layer of the uterus. This is the structure of uterus is present. This is the uterine cavity, and this is fallopian tube. This is ovary which is present left and right side of the uterus, and the innermost layer is called the endometrium. Then below the uterine cavity there is the cervix is present, and below the cervix there is the vagina is present. So this is the short anatomy of the uterus, and which are the hormone responsible for the menstrual cycle we have shown. Then next we will see the ovarian cycle. The ovarian cycle, there are two components. I have told previously, there are two components are present. First one is the ovarian cycle, then second one is the uterine cycle. So firstly we will see the ovarian cycle. What are the changes occur in ovaries? So firstly we will see the ovarian cycle refers to the periodic changes that occur in the ovary every month during the reproductive life. What is the reproductive life? That is the 13 to 45 or 49 years of age. Then cyclic changes in the ovarian occur in the response to anterior pituitary hormone, that is the follicular stimulating hormone and luteinizing hormone. Follicular stimulating hormone is responsible for the maturation of the Graafian follicles, and luteinizing hormone is responsible for the ovulation process. So this is the ovarian cycle. Next we will see the ovarian follicle development. Here the when the female is in fetus form, that a fetus have 6 to 7 million in 20 week of gestation. Means fetus has 6 to 7 millions ovarian follicles or Graafian follicles in 20 weeks. At birth it less, that is 1 to 2 million. Then at puberty it remain the 3 lakhs, the number of the 3 lakhs that releases during the ovulation, that is 400 to 500 ovum. At menopause it is rare. Then next, here we will discuss about the changes in the ovarian cycle. You can see that there is a picture shown, which first one is the primordial follicles, which becomes primary follicles, then it becomes secondary follicles, then it becomes Graafian follicles. Then ovulation occur. The outer covering of the Graafian follicles, it becomes corpus luteum, and this ovum is releases from the ovaries and captured by the fimbriae that is present in the fallopian tube. Then this is the ovulation process. This is the process of the ovarian cycle. Here the written things, that is the changes occur that in the ovary. Each cycle can be divided into 3 phases. First one is the follicular phase, that is the day 1 to 13. Then second one is the ovulatory phase, that is day 13 to 15. Then third one is the luteal phase, that is day 15 to 28. So this is the follicular phase. Yeah, from primordial follicles to Graafian follicle, it is the follicular phase, that is 1 to 13 days. Then ovulatory phase, that is the ovulation process. This is the ovulations, that is 13 to 15, approximately this is the 14 day, we can say this is the 14 day of the ovarian cycle. Here the ovulation process occur, so it is called, that's why it is called ovulatory phase. Then third one is the luteal phase. After ovulation, the outer covering of the Graafian follicles, or it becomes corpus luteum. The function of the corpus luteum is secretes the estrogen and progesterone, which which maintain the early pregnancy, which can maintain the early pregnancy. If the conception is not occur, it becomes corpus albicans, and after that it get be degenerated. Then this is the ovulation phase, that is 14. Then it is the luteal phase, that is 15 to 28 days. So here you can see, the here is the egg cell is present. This is the ovary. Here the maturation of the follicles is present. This is this, I told earlier previously slide, I told this the follicular phase, that is the 1 to 13 days. Here the uterine cavity changes, endometrium begins to develop. Then next, at the beginning of each menstrual cycle, the hypothalamus secretes GnRH, that is gonadotropin releasing hormone, in pulsatile manner to stimulate the anterior pituitary. So it gets secreted FSH and LH hormone. FSH means follicular stimulating hormone, and LH means luteinizing hormone. FSH is responsible for the growth of the several primary follicles. Then only one follicles on one of the ovaries reaches maturity, or Graafian follicles, which secreted estrogen. Then estrogen has a negative feedback on the pituitary to stop FSH, that is follicular stimulating hormone. Then estrogen cause the uterine lining, endometrium means progesterone endometrium, to growth and thicker. What is the hormone? Estrogen hormone. Then second one is the ovulatory phase, that is the day 14. In this period, the ovulation occur, and this catches by the fimbriae of the fallopian tube. This is the fimbriae, and it gets the ovulation phase, the ovulation occur, and this is catches by the fimbriae of the fallopian tube. Next, we will show the estrogen peak stimulated secretion of luteinizing hormone, and luteinizing hormone peak leads to what? Leads to the follicle to burst open. Here you can see, then releasing the mature ovum into the abdominal cavity, processed by the ovulation. This process is called ovulation process, and corpus luteum form the outer curve. The remain thing in the ovaries, the outer covering of the Graafian follicles, is called corpus luteum. And then ovulation occur on 14 days of 28-day cycle. The high estrogen also suppress the FSH secretion, so no further follicle growth. Okay. Then next, luteal phase, that is the 15 to 28 days. Here the if the any conception is not occur, okay, so the ovum is transport here the uterine cavity, and it leads to here this phase is remain the 15 to 28 days, and it leads to the next menstrual cycle. You can see the shedding of the menstrual cycle is occur. The process is called menstrual bleeding or menstrual menses. Then next we will see, after ovulations, the LH level remain elevated and cause the remnant of the follicle to develop into the yellow body is called corpus luteum. Previously we have know this. Then in addition to producing estrogen, the corpus luteum secretes hormone is called progesterone hormone, which is responsible for maintaining the early pregnancy. Okay. Then next, we will see the when the progesterone hormone reaches the high level, it inhibits the secretion of luteinizing hormone. So when the luteinizing hormone decreases, so the any ovulation is not occur. Then degeneration of the corpus luteum If the fertilization is not occur, any conception is not occur, at that time the degeneration of the corpus luteum is started. Then, and so the estrogen and progesterone levels have drop after 28 days in luteal phase. Okay, so the progesterone and estrogen hormone drops, and separation of the endometrium, that is called menstruations, and stimulate the hypothalamus to secrete more GnRH, and this hormone in stimulate the anterior pituitary gland for beginning of the next cycle. Then this is the menstrual cycle. You can see this is phases of menstrual cycle. First one is the menstrual phase. Here the bleeding occur. You can see this is the endometrium layer. This is the shedding of the endometrium layer occur. This phases remain 1 to 5 days. Then after this phase, it goes to the follicular phase. In this phase, the follicle, the follicles or maturation of the follicle occur. This phase is going on in the ovaries of the uterus. Then next one is the after follicular phase. This is the ovulation phase. In this phase, this is the phase of the 14th day of the menstrual cycle. In this phase, the ovulation occur. Then next, if the any conception is not occur, any fertilization is not occur, then this phase is goes to the luteal phase. In this phase, remain the ovum is remain inside the uterine cavity, and the shedding of the progestational endometrium is shedding of the progestational endometrium is started. It's beginning. Then next we will see, this is the cycle, menstrual cycle. Then we have discussed about the there I have told previously there are two components. First one is the ovarian cycle, a second one is the uterine cycle. Ovarian cycle we have discussed. After this we will discuss about the uterine cycle. The uterine cycle refers to the changes that are found in the uterine lining of the uterus. These changes comes in the response of the ovarian hormone, but those contained are goes continuously or simultaneously also. Then estrogen and progesterone, there are four phases to this cycle. First one is the menstrual phase, second one is the proliferative phase, third one is the secretory, and fourth one is the ischemic phase. The menstrual phase. Day 1 of the menstrual cycle is marked by the onset of menstruations. The first day of the menstrual cycle is marked by the first day of the menstruation. During the menstrual phase of the uterine cycle, the uterine lining is shed because of the low level of the progesterone and estrogen hormone. At the same time, the follicular begin to develop and start producing the menstrual phase, and ends the menstrual period stop on approximately 5th day. Okay, so we can say the menstrual phase is 1 to 5th day. The duration of the menstrual phase is 1 to 5th day. So next we will see, this is also called the menses or menstrual phase. Next phase is the proliferative phase. When the estrogen levels are high in menstrual phase, the estrogen progesterone level is low, and then next phase the estrogen progesterone level is high enough, the endometrium begins to regenerate. Okay, then estrogen stimulate blood vessels also to develop the blood vessels, in turn bring nutrients, oxygens, and to the uterine lining, and it begins to grow and become thicker. Okay, the proliferative phase ends with the ovulation day, that is the 14th day. 14th day means we can say that this phase is started from the 6th day to 14 days. Okay, 14 days. Then next phase is the secretory phase. After the ovulation, the corpus luteum begin produce progesterone. What corpus luteum? This hormone is causes the uterine lining become thicker, rich in nutrients, and prepare for the pregnancy. This hormone is responsible for the maintenance of pregnancy also in early pregnancy period. Then estrogen levels also remain high, so that the lining is maintained. If pregnancy does not occur, That time what happened? The corpus luteum gradually degenerated and the woman enters the ischemic phase. Okay, the phase of the menstrual cycle. This is the secretory phase of the menstrual cycle. Then next we will see the ischemic phase. On 27th to 28th, estrogen and progesterone level fall because of the why? Because of the corpus luteum is no longer present, no longer production of the progesterone and estrogen hormone. Then without hormone, to maintain the blood vessels that is goes through the endometrium layer is not present, then the uterine lining becomes ischemia. Ischemia is present. Ischemia, the term ischemia is the lack of blood supply. When the lining starts slug and the woman has come full cycle, and once again it first day of the menstrual cycle started. So this is the ischemic phase. So there are two contained of menstrual cycle we have discussed. First one is the ovarian cycle and second one is the uterine cycle. You can see here the endometrium layer. This is the premenstrual. This is the menstrual period. The size of the endometrium, thickness of the endometrium you can see. Then the post-menstrual period. When the ovulation occur, at that time the thickness of the endometrium is more. Then this is the endometrium layer. You can see the endometrium lining of the uterus. When the early period, if you proliferative period, the thickness of the endometrium is more, and the ovulation it lasts about the ovulation period. Then it becomes shaded in the menstrual period. Then cervical mucus changes in the cervical mucus takes place over the course of the menstrual cycle. Some women use these characteristics to help to determine why ovulation is not likely to happen. During menstrual period, the cervix does not produce mucus. During menstruations, the cervix does not produce any mucus. As the proliferative phase begins, the cervix becomes produce a tacky, crumbly type of mucus that is yellow or white. Tacky and mucus, crumbly type of mucus present. When proliferative phase has started. Then as the time of the ovulation become near, the mucus become progressively clear or thin. It is visible clear or thin like. Then lubricative and with the properties of raw egg white, like raw egg white property, you have seen that type of the mucus is present at the time of the ovulation. Then at the peak of the fertility, that is the during ovulation, and the mucus has the distensible, stretchable called spank-barcate, and after the ovulation the mucus becomes scanty, thick and opaque like whitish or yellowish. This is the graphical representation of the phases of the menstrual cycle. Here you can see menses period, then proliferative phase, the thickness of the in ovulation phase में the thickness of the endometrium layer, then thickened endometrium layer in secretory phase. Then this is the next slide. Even the menstrual cycle, we will see in the flow chart what will happen, what we have learned. So we will discuss in this. Then first one is the hypothalamus. You know that is the present in the brain, and hypothalamus secrete GnRH, that is gonadotropin releasing hormone, which stimulate the anterior pituitary. Second one, you can see the GnRH hormone stimulates the anterior pituitary to secrete luteinizing hormone or FSH, that is follicular stimulating hormone. And LH hormone and FSH hormone, what is the function? The LH hormone is responsible for the ovulation, and follicular stimulating hormone is responsible for the maturation of the follicles, Graafian follicles. Then next one is the Graafian follicle is stimulated by the LH or FSH hormone. Then ovary release estrogen by the corpus luteum. Then next, high estrogen level is present because it is secreted by the corpus luteum. Then high estrogen levels inhibit FSH for no secretion of no for inhibit the secretion of FSH and stimulated LH hormone productions. Then LH makes the mature follicle burst because LH hormone is responsible for the maturation, ovulation. Then LH hormones makes mature follicle burst, that is called ovulations. Then LH makes the corpus luteum, the outer covering of the Graafian follicles, which is secreted the progesterone. Progesterone hormone inhibit the LH secretion and decrease the LH or FSH level, which is inhibit or decreases by the estrogen and progesterone. Then at this time the estrogen and progesterone is high, the corpus luteum atrophy when any conception or fertilization not occurs, and they goes the corpus luteum atrophies and stop making progesterone. That is, then it leads to the decreased estrogen and progesterone level and stimulate the GnRH, that is gonadotropin releasing hormone secretion. Okay, this is the again next cycle is started. So there is the proliferative phase, secretory phase or menstrual phase. This is the uterine cycle, and follicular stage and luteal, that is the ovarian cycle. So this is all about the menstrual cycle. So thank you for listening.